up here is Paulo, Henrique, and you talk about the dynamics of viremia and oral extraction of human herpes A virus, which has the positive and negative
Good afternoon, everyone. I'm Paulo Braz. I'm postdoc fellow here at the São Paulo Institute of Tropical Medicine. First of all, I would like to thank Professor Sabino for the invitation and all the audience to be here. I'm going to present my postdoc project research entitled HHV8 oral shedding and viremia in HIV positive and negative patients. This project is being developed here in association, in collaboration with School of Dentistry, Department of Oral Pathology, University of São Paulo. HHV8 was discovered in 1994 by Cheng and colleagues. This is an enveloped DNA virus, and the closest human herpes virus relative is Epstein-Barr virus. We have strong evidence that HHV8 has a causal role in Kaposi sarcoma, all forms of Kaposi sarcoma, and because of that, he's also known as a Kaposi sarcoma associated herpes virus, and primary effusion lymphomas and multicentric Castleman disease. HHV8 belongs to the herpes virus family and subfamily gamma herpes virus, and the related virus is HHV4 Epstein-Barr virus. To establish HIV serologic status is not very easy. We have two different targets, antibodies, latent antigens and targets, and lytic antigens targets. And we have essentially two assay formats, immunofluorescence assays and ELISA. But although there is no true gold standard for the diagnosis of HHV8. HHV8 and EBV have some similarities, for example, tropism for lymphocytes. They could lead to lymphoproliferation association with malignancies, especially lymphocyte malignancies. We can found latent infection in tumoral tissues and a possible oral shedding as other herpes virus. But at the same time, they have completely different behaviors regarding prevalence and world population, completely different. Low prevalence in North Hemisphere. We have low prevalence in North Hemisphere. We can see here some studies from USA, UK, Japan, Hungary, North Hemisphere, USA and Europe. The rates ranging from 5%, 0% and 5%. Here in general population. Here in Brazil we have almost the same status for HHV8 seroprevalence here in Brazil. the rate ranging from 0 to 2.5% in general population. But HHV8 is mainly endemic in areas of high endemicity for classic or endemic Kaposi sarcoma. For example, here in Mediterranean area, in Italy, especially South Italy, the rates ranging from 11% to 24%, especially these islands, Sardinia and Sicilia. We have other regions endemic for Kaposi sarcoma and HHV8. Here we see some countries from in Africa, for example, Botswana. 90% of the general population infected positive to HHV8. And here in Brazil we have in the north a specific population of Amerindians. We can see here 79% HHV8 positive. But even in countries non-endemic to Kaposi sarcoma and HHV8, we have specific population with higher incidence of HHV8. For example, HIV positive patients and HIV positive patients, men who have sex with men, even the HIV negative men who have sex with men. If we compare the seroprevalence of HHV8 with the general population, blood donors, for example, we can see a higher seroprevalence of HHV8. And an important question is the transmission of HHV8 and saliva, the relationship between HHV8 and saliva. HHV8 is more frequently found in saliva if we compare with other body fluids, for example, semen. HHV8 oral shedding seems to be intermittent. Because of that, it's important to verify and to study sequential samples from the same patient. And the saliva seems to play a major role in the viral transmission and may be a reservoir for HHV8. With this background presented, we decided to propose this study, HHV8 oral shedding and viremia in HIV positive and negative patients. Negative patients, men who have sex with men. Until now we have enrolled in this project 81 HIV positive patients and 24 men who have sex with men, HIV negative participants. We propose a 3-month follow-up with 6 dental appointments. In each dental appointment we performed blood collection, 4 different blood collection, whole blood, PBMC, plasma and serum to compare these compartments. Three different methods for saliva collection: stimulated and unstimulated whole saliva collection with a specific kit, and we propose to oral rinse with a mouthwash, a commercial brand Listerine mouthwash. And I think the main objective of this study is the self-collection, daily collections made at home by the patient. Each participant received a self-collection kit including detailed written instructions and was asked to provide an oral lavage sample on waking up and before eating, drinking or brushing their teeth by washing their mouth vigorously for 30 seconds with 10 milliliters of mouthwash, Listerine, and expectorating into an empty collection container, or Falcon tube. Here we can see the method to collect saliva, old saliva. It's a German method, Salivette, a standard method for collection of saliva for diagnostic. Saliva is easily obtained by showing on a row-shaped saliva collector. For collection, stimulated saliva, this row is previously treated with citric acid. And for the oral rings, we performed with a Listerine commercial brand mouthwash. And in 3 months follow-up, we expect to have samples from each patient. 6 blood collections, plasma, serum, PBMC, whole blood. 6 saliva collections performed at dental office, stimulated, unstimulated whole saliva, oral rinse at the dental office. And we expect to have 60 oral rinse self-collections performed at home by the patients with the instructions. To establish the HHV8 serum status, we performed ELISA and immunofluorescence assay, LANA and LITIC. DNA extraction was performed in an automated extraction platform, EasyMag automated extraction platform. To quantify and to verify the HHV8 positivity in saliva samples and blood samples, we performed a quantitative real-time PCR for a specific region of the virus, open reading frame 26, in a TACMan assay. With this project, we want to address some questions. For example, the techniques of sample saliva collection are similar regarding the quantity of DNA. We are compared the quantity of the DNA collected by different techniques to collect saliva. Compare stimulated and unstimulated saliva with oral rinse, and compare the oral rinse performed at dental office and self-collection at home. Another question is the best compartment to study HHV8 in the blood, because it's not completely understood on the literature. We analyzed plasma, PBMC, serum, and whole blood. And it's important to have more information about transmission of HHV8, define a dynamic of HHV8 oral shedding, and compare this with serological status, possible viremia, and clinical data too. I will show you some preliminary results from the study. Here we can see a table, in this table, some clinical data from HIV positive patients, 81 HIV positive patients. The majority are male, 48 patients. Here we can see CD4 count. The majority has upper to 500 CD4 cells per cubic millimeter of blood. And here we can see the majority of the patients have undetectable viral load HIV. It's important to notice that all the patients are under high activity antiretroviral therapy, and they have no history, previous history about Kaposi sarcoma. Here I'll show you some results about HIV serological status from these patients. We performed the ELISA until now. From the patient, HIV positive patients, we have 24, 30% HHV8 positive. And the men who have sex with men, the other group, we have 2 from the 24 patients, HIV positive, almost 42% HIV positive. In this table here we can see some results regarding the DNA quantity in saliva samples. We compared 4 different methods to collect saliva. Here, stimulated saliva with the salivate without acid, citric acid. Here, unstimulated saliva, dental office oral rings, and homemade oral rings made by the patients. We don't have a significant difference between these 4 techniques. And we showed that's possible through the self-collection through this kind of studies. Here we have results about the saliva samples, homemade saliva samples from HIV positive patients, HHV8 positive patients. And we analyzed 20 samples from each patient. And we have only 4 positive samples. 1 from patient 9 and 3 from patient 44. We analyzed 2 the whole blood samples from HIV positive, HHV8 positive patients. 24 samples, on 24 samples. We performed the PCR until now. And no sample positive. We have no sample positive, 0%. As a preliminary conclusions, stimulated and unstimulated saliva samples, oral rings performed at dental office and at home showed similar quantities of DNA. And HHV8 oral shedding or viremia were rare events in the analyzed patients until now, HIV positive patients were analyzed until now. I would like to thank all the staff of Institute of Tropical Medicine, especially Professor Pannuti, my supervisor, Professor Ueda, Laura Sumita, Tânia Tozeto, e Wilton Freire. And I would like to thank School of Dentistry, Department of Oral Pathology, Special Care Dentistry Center, CAPI for USP, especially Professor Galottini and Professor Ortega. Finally, I would like to thank São Paulo Research Foundation, FAPESP, for financial support. Thank you very much for your attention.
What about PBS or something more physiological than Listerine? I thought it was supposed to kill bacteria. What does it do to acid nucleic?
Because we have some studies, especially with HPV detection, that use this kind of oral rings. And it's a cycle from the patient. The patient, oh, okay, now it's Listerine. And I think, and to conserve, I think it's better because they have in the formulation high quantity of alcohol, and maybe it's nice to conserve the sample.
So I missed how many samples you had in that picture you showed. I wasn't sure how many.
From each patient.
So what was the line? Is this number? Which one is a patient? No.
Here we have the number of patients.
Is the patient?
Here we have the.
Mais embaixo.
Here we have the number of the patient in the research protocol. 1, 3, 7, 9. It's the number of the
So you have
patients.
already performed 20 samples from each
From
one?
each patient, yeah. Yes.
It's very, it's rare.
Yeah. Until now. Maybe, I don't know, maybe we have in the literature there's a paper similar to this study, but they performed the study in a specific region of Uganda. And all the patients aren't not in the high antiretroviral therapy. Maybe, I don't know, if the heart could interfere in this shedding. I don't know.
Can you go back to the table? Yeah, 44. So it doesn't look like your samples that have more DNA are the ones that are positive, because your positive was in a fairly low.
Sorry.
So the sample 44 was
44 is the-
positive, but it didn't
yeah.
have tons of DNA. I mean, it had the average amount, right?
Yeah.
So it looks like you're okay for your quality of
Yeah.
what you're getting out.
I think in the oral, in the saliva and oral rings, I think it's okay.
It's okay. Can you try some people who are not on antiretroviral therapy to see if you
Here in
get
Brazil,
more?
it's really, really difficult.
Yeah.
Over there,
Yeah.
there's maybe
I don't know.
tem paciente sem não está ainda em tratamento, everybody's going to treatment, right? No.
I have been with
Maybe
Does it
because at
become
the special care dentistry,
Yeah.
we have a specific population.
Yeah.
It's really difficult.
Better, yeah.
Yeah,
We
but
had
maybe
2 or 3 patients, and but with 3 patients, I think.
yeah, because maybe early on people misdiagnosed and that's not a kind of therapy.
Yeah, maybe.
Because now we are moving towards treating everybody.
Oh,
That's
wow.
what the guy,
Nice.
director of the
Yeah.
program wants to do, just have a diagnostic treat.
Wow. Yeah, that's what we're doing in San Francisco too.
But there are still some people that,
And we have people too that aren't on treatment.
Yeah.
The policy is one thing, the reality is another.
Are you going to investigate only the patients that were positive for serology or all patients?
All patients, but we choose these patients HHV8 positive just to verify, but all the patients.
Beginning or
Yeah,
to start by this patient?
Yeah.
And also, which kind of cells the pertussoid is latent? You know, the latent, not a latency, but
Oh.
que tipo de célula?
Tânia, cadê você? I really don't know. What's Tânia? We performed the ELISA and Tânia and Wilton performed ELISA and immunofluorescence.
Because I think some specific cells and maybe heart not have, but the level of CD4 and CD8 cells that you have in these patients may influence the viral load if the virus can affect this
Can
kind
affect
of
this
cells.
kind, yeah. Maybe.
okay, thank you. So now the last one is Marta Eugenia Jimenez. So she will be a little bit different. It's evaluation of a vaccine based on the peptide B10 and therapeutic techniques to analyze